Good afternoon, everyone. You have found us at 12 noon on Thursday, July 29th for the latest update on the local COVID situation from Peterborough Public Health. Thank you very much for joining us on this soggy afternoon. It's my pleasure to welcome you here and to take a moment to honor this beautiful place that we enjoy our lives and where we live. I will just take a moment to offer a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 and Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, and now I would like to invite our Board of Health Chair, Mayor Andy Mitchell, to lead us with some opening remarks. Please go ahead, Andy.
Thanks, Brittany. As we continue to make progress on our vaccine rollout, it will be important that we continue a cautious and measured approach to reopening in advance of reaching our provincial and local vaccine targets. We have only to look at other jurisdictions around the world that are experiencing a surge of cases to understand that our community remains vulnerable to more infections, especially with circulating variants and especially among those not vaccinated. This week, the Association of Local Public Health Agencies, the organization that represents public health units across the province, suggested a 5-point strategy for moving forward, and which I believe makes good sense. First, maintain infection prevention measures in public places and workplaces. This includes such things as continued mask wearing, screening of employees, capacity limits, safety plans, and keeping paid sick leave in place. Second, continue an all-of-society vaccination effort. This means continue to aggressively use a multitude of delivery agents and to specifically target hesitant populations. Third, consider undertaking policy measures that incentivize vaccinations and give complacent or hesitant Ontarios a nudge to seek the vaccines. An example of this was the policy developed for long-term care facilities. Fourth, develop and quickly communicate to parents a plan that ensures the opening and continued operations of in-person schooling. The early months of school reopening will be a critical time period to maintain preventative measures within the school system and recognize that students under 12 will not have been vaccinated. Fifth, maintain local resources for pandemic control. Critically important will be investing resources to address flare-ups through contact tracing and outbreak management, as well as aggressively pursuing immunization. Together, the Peterborough region, city, county, and First Nations has made good progress in controlling COVID-19. It's time to finish the job, and the 5-point plan from Alpha will help us do that. Stay safe, be well, and in all things, be kind.
Thank you very much, Mayor Mitchell, and for characterizing this stage of the pandemic in our community. So let's now hear from Dr. Salvaterra to show us where we stand in terms of the statistics. Please go ahead.
Thank you, Mayor Mitchell, and thanks, Brittany. I'll begin with our current case count as of 4 p.m. yesterday. We remain at 5 active cases, which is the same number as last week. So we are resolving cases at the same time that we are gaining new ones, but the numbers are remaining low. Variant of concern testing continues to confirm that we do have Delta variant transmission occurring in Peterborough. And just a reminder that the Delta variant is twice as infectious as the last year's coronavirus strain that was circulating. We also have 18 high-risk contacts that we are following. Next slide, please. Here you can see our weekly case counts, and they remain low, but we're certainly not having the same COVID-free summer that we had earlier in the pandemic. Next slide, please. On this slide on the left, you can see the gender breakdown of our all cases reported to date. So slightly more men than women who've tested positive for COVID here in Peterborough. In the bar graph, we are showing you the ages of the new cases over the last 4 weeks. This information comes to us thanks to a new interactive feature on our COVID tracker. So now you can select any date range that you like, and you can see how those cases break down by age and gender. We are still working on providing case data by vaccination status, and we hope to have that functionality on the tracker soon. So over the past 4 weeks, you can see that those under the age of 29 years represented the highest proportion of new cases reported to us. I will also show you the percentage of these cohorts that are vaccinated in just a moment. Okay, on to active outbreaks. Fortunately, we have still only the one active outbreak in our community, and it is expected to resolve soon. Next, we'll go to a map that shows you Peterborough's weekly case incidence rate as it compares to the rest of the province. Starting on the right of the slide, you can see that our weekly case incidence rate for the period ending July 24th increased to 3.4 cases per 100,000. Now that's up from 1.4 the following week, but it certainly is still well below the provincial case rate of 7.5 cases per 100,000. The map here does give you the case incidence rates over the last 14 days in every area in the province. Peterborough is there in green, and as with much of the province, only Temiskaming remains case-free. They're shown in light blue, and you can see that the current Delta hotspots are continuing to show higher rates of infection. We'll go to the next slide to look at our wastewater surveillance. And the data from our wastewater treatment plants continues to be very encouraging. The red bars represent the Peterborough facility, blue bars are Millbrook, and you can see that over the past week, Millbrook is not detecting any COVID-19, and Peterborough, the city, continues with very low levels of virus being detected. Okay, we're going to move on to vaccination. So here we are showing you the current vaccination data at the end of yesterday's clinics. The pace of vaccinations continues to plateau. Last week, 1,000 more of our local residents received their first dose, and close to 6,000 received their second dose. If we look to these half circle charts beginning on the far right, you will see that over 79% of our eligible residents have their first dose. Oh, sorry, we're going to start on the right. I'm looking at the left. So let's start that again. So if we look on the right and we start there, and that is the population that's 12 years of age and over, you can see that close to 79% have received their first dose, and close to 68% are now fully immunized. In the middle, we are showing you our youth data, and you can see we need to do some more work here. We've got only 43% of that group fully immunized. We'll need to see much higher vaccination rates in order to prepare for a safe return to school. And if we go to the next slide, please. We're going to show you here the percentage of first and second dose by ages. And you can see that first doses among the youngest age group only increased by about 3% last week. It now stands at 69%, but second doses in the same time period increased by 14%. So that was great. I'm not quite sure how to explain the fact that the 50 to 59 age group has a little bit of a dip there in comparison to the younger aged in their 40s. But you can see that on the left, when we look at how our vaccination rate stacks up for our community as a whole, which includes everyone, including the children, you'll see that we are almost 70% with one dose, and we are at 60% fully vaccinated. So overall, we do still have a way to go to reach that remaining 14,500 people in our community that it would take to get us to 90% rates of the total population. So I want to emphasize for today really what the benefits of a two-dose summer are for those who have both doses of their COVID-19 vaccines. While many of us are enjoying the reopening of our businesses and activities, the positive effects of immunization go well beyond this. Public Health Ontario has estimated that 31,000 cases of COVID-19 among individuals 18 and over have been prevented by immunizations this summer so far. A further 2,500 hospitalizations or deaths have been prevented among individuals aged 70 years and over. So, and these are likely an underestimation, but they tell the story of how well vaccines are saving lives, preventing hospitalization, and protecting our communities. So I extend my thanks to the close to 89,000 local residents who are now fully immunized. We are now seeing, as other experts are noting, the pandemic shift to those who are unimmunized. Our own numbers and cases reflect that our youth and younger adults still need better protection. The risk of getting COVID-19 is 6.4 times higher in unimmunized individuals compared to those who are fully vaccinated, which means that you do remain vulnerable until you get your shots. We have the capacity and the vaccine supply to see these immunization rates climb faster. And I encourage everyone who has not yet had their shot to make an appointment either with our mass immunization clinics or at a local pharmacy, or to take advantage of the walk-in options and just get her done. This is especially important as we prepare for a school year, new school year. With the 28-day interval needed between doses and the 14 days that are required to build full immunity, if you are 12 years of age or older, now is the time to get your first COVID-19 shot in order to be fully immunized in time for school reopening in September. I urge all those students, all those heading into high school or off to university and college who haven't yet received their first doses to act this week You will face fewer disruptions to your in-class learning if you are fully immunized. Getting a dose has never been easier, and we continue to provide walk-ins at our Evinrude Center when it will reopen on Tuesday following the move from the ice pad back into the multi-purpose rooms over the weekend. It is open it is open evenings as well. PRHC Mass Immunization Clinic remains open in the mornings for youth vaccinations on Tuesdays and Thursdays. And you can book an appointment or you can simply walk in. Plus, our vaccination team is heading out to the county to offer pop-up clinics in Apsley on August the 3rd, in Buckhorn on August the 7th, and in Millbrook on August 17th. The window of opportunity, though, for students and school staff is closing. It is time to act now so that we can begin the school year as safely and normally as possible. Dr. Moore, our Chief Medical Officer of Health, has begun to share details of what we may expect for school this fall. Fully immunized students and staff will have a significant advantage in that they will not need to self-isolate or be excluded from school should they be in close contact with a case in their home or classroom. They will be able to stay in school and attend sports and participate fully in school social activities. So please, for all our Peterborough families and school staff, get your COVID-19 vaccine as soon as possible so that you can minimize the disruption to your family's life and to the school community. I would also like to clarify for our Peterborough travelers that Ontario does not endorse or support a third dose for that purpose. The vaccine we have been allocated is intended to help us achieve herd immunity and must be reserved for those who still need their first or second dose. I understand that our federal government is addressing the issue of travel at the international level. I will do what I can to advocate on the behalf of our residents who did the right thing. They stepped up and they took the first vaccine available and who are now caught up in this international cocktail of vaccine policies. I have personally written to the medical director of Princess Cruise Lines asking for a change in policy, and I have been assured by our federal MP and my provincial colleagues that the right people here in Canada are aware and are on this important matter. I have full confidence that it will be resolved in due time as mixing equivalent vaccines is safe. Other countries have followed this vaccination schedule and it affects travelers around the world. So I'll stop here and hand it back over to you, Brittany.
Thank you very much, Dr. Salvaterra. Okay, I believe we have our county warden joining us today, and I would like to invite Warden Jones to share any comments or perspectives from the county. So please go ahead, Warden Jones.
Okay, thank you very much for including the county once again. I'll be brief. We are still here at the county in a technical state of emergency, and we made that decision on purpose. It's more symbolic, I guess, than anything else right now. We're trying to show support to our health unit. We are trying to continually say that we're taking this very seriously. And once the numbers are at what we consider to be a reasonable rate, an emergency. We appreciate the pop-up clinics that are going on throughout the county, and this has more impact, I think, than people realize. Not everyone have the means to drive into the city whenever they feel like it to get a shot. So these clinics are very, very much appreciated. We at the county, we are starting our planning to get back to whatever normal is going to be. Our live council meetings in our council chambers, our staff returning to their desks, but we are taking it very slowly, and we want to make sure we're doing the right thing in the right amount of time. So we're on that. And today at 2 o'clock, as a matter of fact, and I hope the media will pick up on this, we're going out to Fairhaven to say a huge thank you to all the staff at Fairhaven for everything they've done over this whole pandemic. There's so many people to say thank you to, of course, all the frontline workers, all the people who work the health unit, all the people who work in public works. But today we're going to salute the Fairhaven gang. Rain and shine, they showed up for work, looking after the most vulnerable. So today, a few of us are going to show up outside at Fairhaven and give them a little treat and basically just say thank you. And we really do appreciate everything they've done. So that's it from the county perspective. I do urge everyone, please get that vaccination. Let's listen to the health professionals who know what they're talking about, not someone who reads something on the internet, not someone who puts a sign on their front lawn. Let's have a little bit of trust here. It's not all about you. It's about all of us. So please get your vaccination. So on behalf of the entire county of Peterborough, thank you everyone for doing the right thing. And let's keep a stiff upper lip and let's all get through this. So thank you very much.
Thank you so much, Warden Jones. Great to have you with us today. All right, now we'll invite our media partners to ask some questions, and I will start with Matt Latour. I'm not sure if he's still with us and able to lead us off. He indicated he might have to jump off to do some other reporting, and I'm not seeing a response, so maybe we'll move on from Matt. So then let's hear from Paul Rellinger from Kawartha Now. So if you've got some questions for Dr. Salvaterra or our enforcement partners, we also have reps from Peterborough Police and the OPP on the line. So go ahead, Paul.
Thanks so much, Brittany. Hi, Dr. Salvaterra. You were talking about that window of opportunity for students and teachers, and it's closing rapidly in terms of getting back to school in September. With that in mind, are there any things in the back of your mind in terms of special, like if those numbers don't start increasing and getting better, special clinics or any kind of strategic approach to try and get those numbers up?
Well, that's a great question, Paul. And in fact, we are planning ahead for September. We'll plan to support, again, to make immunization as easy and convenient as possible. We are actually beginning our plans next week because we're looking not only at the COVID-19 vaccine and making sure that those 12 and over have it, if they haven't already had the opportunity, but we're also looking at the other immunizations that we typically offer at school, which is the meningococcal, the hepatitis B, and the HPV vaccine. We want to make those available to 12 and over as well. And we also want to make sure we provide access to some of those childhood vaccines that are mandatory for school attendance. We know that in this past year, immunizations may have dropped off the radar. So we are doing that planning, and there will be ways to catch up. In addition, we've been in conversation with both Trent and Fleming, and certainly been speaking to them about making vaccines available to the students on campus. So for those students as well who maybe didn't get around to it, still need a second dose or haven't taken the plunge yet, we'll make it as easy as possible.
It's a busy time of year for you, for sure. You mentioned Trent and Fleming and the possibility of going on campus. Is that a consideration, again, if you don't see these numbers increase for high schools or even elementary schools, that you would have clinics at actual schools? Is that a possibility?
Yeah, it is a possibility. I mean, I think there are logistical issues with schools. I know at least last year that because they spaced out a lot of their classrooms, that the gyms weren't available to us. So with the need for physical distancing, not all schools will have the space to for us to hold a clinic. So we might have to look at, using maybe the Evinrude or other municipal facilities in order to bring those vaccinations closer to the school population. And don't forget as well, Paul, we have our pharmacies, and there are 28 pharmacies. They will continue to offer vaccine. That's a really convenient place for families and for young people to go, as well as family physicians, our primary care providers, nurse practitioners. We're certainly talking to them about making Pfizer, for example, available in their offices back in the fall when their offices are back up and running at full capacity.
Thanks so much, Dr. Salvatierra. That's terrific. Thank you, Brittany.
Great. Thanks, Paul. Okay, so joining us this week from the Millbrook Times is Karen Graham. So Karen, if you've got some questions for Dr. Salvatierra, please go right ahead.
Oh, can you hear me now?
We can hear you.
Okay, good, because I don't have a mic on my computer, so I'm using the telephone. Thank you very much. This has been very informative. I love the graphs. I have a question about the wastewater surveillance results. I see big spikes in the Millbrook. I couldn't see the date, but regardless, when you see spikes in COVID results from your wastewater surveillance, has that data directed any specific actions to date?
Yes, it has. I mean, depending on where we see the spikes, because we do have the wastewater surveillance that I'm showing you today is at our treatment plants, and that's a big population. So so what we would do, I mean, what it really does for us is it gives us a bit of a heads up that's what's coming, that we're going to see more cases coming. So as far as planning for staffing over the weekends, we use the surveillance data. It's very helpful for that. But we also are testing upstream, and that data is for our internal uses only. We are testing around our campuses, some of our long-term care homes, and when we see two consistent spikes there, then we will actually go in and test. So depending on where the signal is coming from, we have a different set of actions.
Great. Some of my questions have already been answered by the graphs, but my overall objective is to find a way to encourage the unvaccinated to engage, and I know that's on your mind. Do you have any, how are you approaching it, and is there anything the media can do to help you in that?
Well, I think for some people who, haven't made it a priority or have other priorities, maybe they're working two jobs and, and they haven't, we know we have a lot of precariously employed people in our community and they can't plan. For them, we want to make it as easy as possible. So I think really promoting the pop-up clinics, mobile, we're going mobile, and also the pharmacies. Those all are ways to help those people overcome their barriers. And then for those who are hesitant, who have a question, maybe I'm on a certain drug, or maybe my naturopath has advised me against it. For them, I really believe that it's their primary care provider, whether it's a family physician or a nurse practitioner, who will be able to sit down with them and answer their questions and give them the best advice possible as to whether COVID-19 vaccinations is a good idea for them, and also to help monitor for those who are afraid of side effects, to help monitor and also report any of those effects should they develop. So I do think primary care is the way to go for many of our vaccine hesitant residents, and I hope that people will reach out to their family physician or to their nurse practitioner and make an appointment to talk about the vaccine. Actually, just to not to go on too long, but to add to that, as of last week, the province is providing data to those physicians who have enrolled patients. So if you're a member of a family health organization and part of the family health team, that data is being provided now so that family physicians and their nurses can reach out to people in their practices who maybe haven't had a first dose or who are late in getting their second dose, and just to invite them to consider being immunized. So I do hope that that's going to help as well.
That's part of the issue, isn't it? Because I was thinking, how could I approach people who are unvaccinated to find out why? But I don't know who they are, and
Right.
they have to volunteer that information, and by definition, they probably won't. So
well,
it's
and
a
you're
bit of a
right.
challenge.
And it is personal health information. So
Sure.
definitely their personal health provider, their family physician or nurse practitioner, will now have access to that data and can make that invitation to come in and have a talk about it and hopefully get immunized.
Will there be anything in the schools in the first few weeks to sort out or to deal differently with students who have been fully vaccinated and are fully immunized with their 14-day, how will that happen? Because again, there's a privacy issue.
Yes, there is. And we certainly have been in conversation, we being the medical officers of health in Ontario have raised this with the province in that we need the data in order to help manage any potential cases or outbreaks in school. But we do recognize it's personal health information. And so there may be a way that we can access it. We do have immunization records on all students attending schools. There may be a way to link those records with the COVAX Ontario system, which we're using for COVID-19. So we're waiting to hear still whether or not we will have access so that we can do that kind of public health work in the schools and try to protect those populations as best we can, or whether or not there may be some other way that the province is planning on having those families who want to share that information share it with their school so that the school has it. So I don't know the answer to your question yet, but hopefully in the next week or two we will be getting more information.
Wonderful. Well, thank you very much. It's a very challenging time, and you and your staff have certainly risen to the occasion, and we're very grateful.
You're welcome.
Thank you so much, Karen. And just to enhance the opportunity for information, anyone who has questions about vaccines, they can even just go to our clinic to ask our staff there, and we have medical clinical experts who can answer their questions. So even if they just want to drop in to speak to some of our staff, they can do that too.
That's
wonderful.
Good advice.
Thank you.
Yeah, great. Thank you. So thank you, Karen. Let's hear from Bill Hodgson from Peterborough This Week and MyCawartha.com. Please go ahead, Bill, if you've got some questions.
Yeah, just a question for Dr. Salvatierra, and it goes back to these slides that you shared earlier, the vaccine rates and such. Has there been any concern that people that have gotten their first dose have gotten a bit complacent and aren't being as aggressive to get the second dose?
Yes, we actually have thousands of people in Peterborough who got their first dose, were given an appointment at that time 16 weeks later, 12 to 16 weeks later, because that's when we had vaccine scarcity, and who are hanging on to those appointments. And so we have been reaching out to people who have had a first dose but have an appointment booked August or later. We've been reaching them by email. I believe we may have tried robocalls, but we're also now speaking to the province where they are going to use some of their capacity at their call center to start phoning these people up and to help them book an earlier appointment. I know that following our emails, we did see people respond the same day and rebook, which was great to see because we have availability in our clinics now. So we can do everyone who's out there who is hanging on to an appointment, we can do you sooner. And so I would really appreciate any help that the media can give us in getting that word out that you should reschedule or walk in, just get her done because we have capacity now, we have vaccine now, and the sooner we get everyone immunized, the better we'll all be.
Okay, and one more question, provincially maybe. There's a lot of controversy about vaccine passports, but there's also been some suggestion that says they may be inevitable in order to protect those who have been vaccinated. Have you had those conversations with your colleagues in the province?
Yes, we have, and I certainly support the idea of some kind of vaccination certificate. We've used these for decades for entry into countries where there is a public health risk from an infectious disease, and they do ensure that those entering that area are protected, and that and they help protect the local residents from the risk that's posed by people coming in who may be unimmunized and may be susceptible because they can go on and infect others. So they've worked for us in the past, and I can't see why they won't work for us going forward.
What about on a more local level in terms of businesses maybe requiring them?
Well, businesses can impose, stricter public health measures. For example, I know for some concerts, if they can ask for proof of immunization or testing. There've been studies done looking at how that can help protect people in those close and large crowds in those close environments. Anyone being immunized does get a record, and you can print those off at home. And you can carry it with you. So if you want to show proof or you're asked to show proof, people can do that now.
All right, that's it for me. Thank you very much.
Okay, thank you very much, Bill. Okay, I see Trent Radio is here with us. Is that you, Rob? Did you have any questions today?
Hi, yes, it is. I just one question for Dr. Salvaterra, and maybe kind of repeating a theme that we've had already. So I'm not sure if you have anything to add for this, but one thing that we've seen, I'm noticing it locally and also in Ontario, and it seems like around the world, there seems to be this disconnect where we talk about 90% being the number we're trying to get to, but 80% immunization seems to be where things kind of level off. It seems like there's some, like we're seeing that locally, in other provinces even, we're seeing first dose, the same sort of pattern, that 80% of people roughly receive their first dose, and then the pace slows down. Is there any reason why, in particular, why you think that there just seems to be 20% of adults who aren't, like, for that number, or what might be causing that?
Well, I think there has been polling done that shows, that there are a small percentage of people, of course, who are vaccine, I would say, resistant. These are the people who will not be immunized. And I don't believe it's possible to change their minds. So we can expect that there will be a small proportion of the population that will not be immunized. We know that there's a small proportion of the population that can't be immunized. They have a medical contraindication. They have an allergy to the vaccine or to one of the components of the vaccines. And then there's a larger group that we call the vaccine hesitant, and they may be hesitant for many reasons. They may be, it may just not be a priority for them. They may not, as we heard the warden say earlier, they may not have a vehicle or access to transportation, or they may not be able to plan their lives, which is why, so I think that's more of a reflection on the fact that we need to change the way we provide vaccines, the mass immunization clinics are not meant for everyone. There are people for whom mass immunization clinics are just not going to work. So there are those who I think will require different strategies. I know, for example, we go out and immunize people in their homes, those who can't get out of their homes, who are not mobile. So there will always be people who will need other strategies. And then there may be some who are unsure, maybe afraid of the vaccine for whatever reasons. And for that group of people, again, I think it takes longer to get them because it depends on their reason. And as I said earlier, I do think our primary care providers, our physicians and our nurse practitioners and peers can be the best ambassadors. I think youth need to hear from other youth. Adults need to hear from friends and neighbors and family, as well as their trusted healthcare provider as to all the advantages of immunization. And slowly but surely, I hope we can see those people also get immunized. So that last 10% that you're talking about, getting from 80% to 90%, it is the most challenging part and will take longer for us to do.
Okay, great. That's everything from me. Thank you very much.
Great. Thank you very much, Rob. Reg Watson from The Examiner. If you've got some questions, please go ahead.
A follow-up to your answer to Rob just now. You mentioned about people not having access to transportation to get a vaccination. Has there been any talk of using taxi companies or ride-sharing companies to offer free rides, or the transit system even?
Yes, in fact, the province has provided some funding, and we do have local access to be able to provide rides for people who need that. So there is that as well, which I think is just, more evidence of the efforts to date and how well we've done. So I think we have a lot to be proud of, but that last 10% is going to take a little more work.
One other question. In counting the vaccinated people, how are you handling snowbirds? There's a significant snowbird population in our jurisdiction. Some of them may have gone south this past winter, and some of them may have gotten vaccinated at the clinics down in Florida or elsewhere. But would they be registered into the COVAX system? How are you able to count them?
So right now, they are coming to 185 King Street, and we are validating their doses and entering them into the COVAX Ontario system. So if you drive by our building in the evenings and you see a long lineup, that's what that's all about. It's people who've been immunized either internationally or in other provinces who are now coming and having their doses registered within our Ontario database.
And do you think everybody is aware that they should be going there?
I don't know if I can answer that question. We certainly have lots of callers or people going onto our website who can get that information, or they can be directed to us. And they are coming. They're long lineups, at least when I've been leaving the building late at night. So I do think we have people who are aware. Do we have everyone? I don't know.
Great, thank you.
Okay, great. Thank you very much, Rob, and sorry, Reg. And I did include an email address in the chat, just with another opportunity where people can access free rides to, or maybe not, I think they are free for certain populations, to access vaccine appointments. So there's another service out there. Okay, let's hear from Jessica Nisnik from Global News. Please go ahead, Jessica.
Thanks, Brittany. Hi, Dr. Salvatierra.
Hello.
I have a few topics to touch on here today. You know, you mentioned that concerts can, say that they want people that are fully vaccinated, or I don't know if you said businesses can do the same. If it's up to a store to decide if they want someone to come in. How can they do that if they don't have the right to ask us because it's private?
Well, it's like when you're flying on an airplane, Jessica, when you purchase a ticket to fly, you are agreeing to the terms and conditions, and they set the terms and conditions. So if you want to fly in Canada right now, you need to get tested. You need to enter your data in the database ahead of time. There are individual business owners and property owners have the ability to set those terms and conditions. As a customer, you can decide whether or not you are going to agree to them. You don't have to. There's nothing saying you have to go to the concert. Or, as I said, take that airplane flight. So I believe that's where the ability or authority lies in the fact that these are private businesses, private properties, and they can set terms and conditions. And as a customer, if you're not interested, you can go elsewhere.
So just the government can't ask us. Like. Okay, so when you talked about you said, I think it was 6 times higher at risk to get COVID if you're unvaxxed, and you talked about the number of people that have been spared and people out of the hospital. I know it's an estimation, but how is that stuff figured out? Like, how do you guys say, for these many people were saved? How do you know that?
So that's data that's coming from Public Health Ontario. And I mean, that's a good question. I'd have to give it some thought, or even better, I'd have to email and ask them how they derived the information. But they're looking at the data, the epidemiology, the numbers, the percentage of people who are immunized and not immunized who are becoming ill, and they're making those calculations. So you're going to have to leave that one with me, Jessica, because I'm going to have to look deeper beyond those numbers to give you the actual technical way that that's derived.
Okay, thanks. Maybe I'll leave it out today if you're not sure, and then I'll include it. But I just always wonder when they give these projections, how did you ever come up with that? And I didn't mean you.
You've given me some homework, and I'll give it a look.
Okay, lastly, I'm wondering about testing. Like, who is still getting tested? I just don't understand how long is our testing center going to stay open? I saw that 55%, or was it upwards of 55,000 people have been tested. So 1 in 3 residents, but how do we know if the same person just isn't a hypochondriac and going back, hasn't been there 5 to 10 times?
Right.
So really, where is this testing going? Who's getting tested?
So right now, for the most part, if you're asymptomatic, you cannot be tested. So it's not the worried well who are going back and getting tested. There are some people who are required to be tested and when they're asymptomatic, particularly people who are we identify as high-risk contacts. So if you have someone in your home, for example, who's a case, we would ask you, even though you're not ill at the time, we would ask you to be tested. And right now, we're actually testing twice. We're testing at the beginning, and we're also testing after 10 days. So those people are getting tested wherever, so the high-risk contacts of anyone who is a case. In addition, it's mostly people who are symptomatic, who are failing their screen. So if right now, any worker going into a workplace needs to actively screen at home before they go to work. And if they fail their screening, they need to go and get tested. And anyone who's sick right now with symptoms that are compatible with COVID-19 is being tested. So it's mostly symptomatic folks as well as the high-risk contacts that are being tested right now.
Good point. I did forget about those high-risk contacts. I mean, we don't have as many, but I guess they have to get tested.
They do.
And I do screen here every day, and if I don't pass, then I would have to get tested. So thanks. How long long do you think we're going to leave that testing center open? At what point have we just done enough?
Well, I know we've already started talking about long-term planning for access to COVID-19 testing. So those conversations are occurring. There has been some phasing back of the COVID-19 testing. We are going to see the Northcrest close and have those paramedics join the assessment center at PRHC in the trailer there to provide testing. So it's being ramped back. I know our primary care providers are starting to talk about, well, can I do COVID-19 in my office? You know, if people are coming in with a sore throat and I'm not sure, is it strep throat or is it COVID? Why not just include COVID-19 testing as one of the tests I do? So I know primary care is starting to give it some thought to see how much of that testing can be repatriated back into the medical offices, the primary care offices and specialist offices. So those conversations are all happening. And I would think that by the time we get to 2022, it will look different. How it will look, I can't tell you at this point, but it is moving in a different direction.
Okay. Because really at this point, I mean, they have the fast tests. I've been tested at Fairhaven.
Mm-hmm.
Like, do you think that you're saying that might be just the way to, it's so fast. It's 15 minutes and you know right away whether you should run and hide or.
And we are seeing the rapid testing expand. So we know that the use of the antigen test is now being promoted for workplaces and other environments, other settings like long-term care, where you need a quick test. And I would expect that once our schools are opened again in the fall, we may see rapid testing occurring in some of those settings where if you're worried about an outbreak, where you may want to do quick testing. So we should see more rapid testing as well as we go forward, as those tests get better and as people learn how to use them appropriately. And as we get other types of collection. For example, I know this summer there have been pilots in both Toronto and in Ottawa using saliva, collection of saliva in younger children to test instead of a throat swab. So I think we'll see that develop as well and be enhanced.
Okay, one last testing question. If someone was a high risk, but they had their 2 doses,
mm-hmm.
would you still recommend that they get tested?
Now I know I should know the answer to that question. I believe I'd have to, sorry, Jessica, I don't want to give the wrong answer.
No problem.
We do. I know they don't have to be isolated. If they're asymptomatic, they don't have to be isolated. Whether or not they still need to be tested, I have to check.
Okay, yeah, that's what I was wondering. Are these people vaccinated or 1 shot or 2? But okay,
Yeah.
Thank you. That's it for me. I was just on a testing frenzy there. Thanks.
Thank you so much, Jessica. I believe we have a question from Reg Watson from the Examiner. So if you would like to ask your question, go ahead there, Reg.
Just a quick request. With the letter that was mentioned earlier to the cruise line, I believe it was, could that be released?
Oh, my letter to the medical director at Princess Cruise. Sure, I'm happy to share that. Yeah, Brittany will. I'll if you haven't seen it, I can give it to you and you can share it.
Certainly, I can do that.
That would be great. Thank you.
Okay. Great. Okay, I believe that brings us to a close. I don't think I've missed any of the media partners on our participant list today. So with that, thank you so much for joining us, and we will see you back here next Thursday at 12 noon. Stay safe out there and have a great long weekend. Okay, thanks all. Bye-bye.
Thanks everybody.
Thank you.